And so now we get into what the plan is moving forward. And the goal is to go ultimately from these broad, community-wide interventions to more focused, more tactical, more surgical interventions. And that's where the contact tracing comes into play. And I went through this last time talking about the bridge tournament, but I want to go over it again because I think it's important, it's critical for folks to understand what our key weapon moving forward is going to be once we start releasing some of these restrictions that we're currently under. And so the way that this works is we have a positive test. A positive case comes back. Someone is ill, they show up to the hospital, or they show up to a testing center, or they show up to their doctor. That test comes back positive. We know that person has COVID-19. We're going to reach out to that individual, find out who that person came into contact with. We're either going to reach out to each one of those individuals, find out whether they are symptomatic or non-symptomatic. If they're symptomatic, meaning now they likely have it, we're going to test them. And we're also going to isolate them. We're going to make sure that they are not around other people who they could potentially infect. And if they need treatment, we're going to give it to them. All right? If we reach out to them and they are not symptomatic, they're feeling quite well, we're going to say, hey, we know you've been in contact with an individual with it. You are at very high risk of developing symptoms yourself. We now know that you can pass this disease on either while asymptomatic, meaning you don't ever get sick, pre-symptomatic, meaning you're not sick now, the next couple days that you will, or that you're minimally symptomatic, meaning you think you feel pretty good, but you got the little sniffles, I'm sure it's just seasonal allergies, but in fact it's not, it's COVID. And so that person is going to go into quarantine, meaning we're going to say, okay, you're at risk of having it, we can't have you passing it on to anybody else, you're going to stay home for the incubation period, which is the 14 days. Okay, the person there, the third one on the right, is someone that we didn't know they existed. The person that we initially contacted didn't know. They went to the grocery and they touched something and someone immediately touched it after them and contacted it. We're not going to know that person, so that person's going to continue possibly to spread the disease to other. That's where the current social distancing comes in. Okay, we're going to assume everybody potentially has it, and so we're doing that. We're going to essentially at some point in the future move away from that, and that's the approach that we're going to take moving forward. All right. That's still what we're doing to this day. We're focusing predominantly on our high-risk individuals, but as we build capacity as Dr. Whelan said, we are able to reach out to all these people. This is important because as we continue through this and as we begin to release restrictions on the movement of people, this is going to be our number one weapon to prevent further spread, to prevent exponential transmission that we saw early on. And this is going to allow the rest of us to kind of get back to business as usual, but continue to keep a lid on the virus. And the way that we're going to do that is by building the capacity of the public health department to have enough folks trained in this so that they continue to do this. And that's what Director Whelan spoke to earlier about bringing on the UC health nurses and other folks. So we feel like we're in a really good place with staffing that we are going to be able to more robustly continue to do this. The reality is as you release restrictions, it is guaranteed that this disease is going to spread. That's just the reality. And so our cases are going to continue to go up. And that's okay, right? There doesn't need to be panic that as we open things up, that cases continue to happen. As long as we have the ability to control it, we're going to be all right. What we don't ever want to have happen is that we have events of transmission that get it out of control so that we can't use these containment strategies. And that's what we're going to do. At this point, we control the spread of the virus based on how we're mitigating it. We are now driving the bus of who gets the virus and how quickly it spreads. All right? And we always want it to stay that way because we do not want to have to ratchet back down if things get out of control. And so it comes to the key component of how we progress from here, and I'm going to talk a little bit more about it, is that it has to be done in a stepwise, thoughtful, managed way. It's like turning on a faucet, right? We turn it on and we control how much of that comes out. We don't ever want to let that tiger out of the cage again, all right? And so this will not be a ticker tape victory parade, let's all get back on the street. That's how we lose control of this thing and end up where we are now. And so we'll have a very clear plan with State Public Health Department, with obviously the governor, and then locally about where we're going and how we're going to manage this and make sure that we can do this responsibly.